On this episode of 26 Minutes with Dr. Warren Seigel, we delve into the life-saving topic of colon cancer screening and its importance as part of primary care. Join us today as we discuss the importance of early detection and how early screening can save lives. We will explore the latest recommendations and guidelines, the screening process, and the role that primary care physicians play in preventing this all too common but prevalent disease. Today, we have Mrs. Shilpa Tharian. Thank you so much for joining us today.
It's a pleasure, and thank you for having me.
So tell us a little bit about you. Where are you from? What was your training?
I was born and raised in India. I completed my Bachelor's of Health Science at S&T Women's University in Mumbai, and I got into a fellowship program for ICU internship. Once I completed that, I worked at the same hospital as an ICU nurse before I moved to United States. I moved to United States in 2005, and I started working as an ICU nurse at Hudson Valley Hospital Center, upstate New York. I moved to Brooklyn after getting married, and since then I worked as an ER nurse at South Brooklyn Health, which was formerly known as Coney Island Hospital. I further went up and took up my education to complete my master's in Adult Healthcare Nurse Practitioner program at Stony Brook Women's University at Long Island University. After completion, I worked as an inpatient nurse practitioner and as an urgent care NP before I joined the team of South Brooklyn Health again as a primary care provider.
So you're working in adult primary care as a nurse practitioner. What area do you specifically address?
In primary care, I work as a PCP for the patients. So
a PCP meaning?
Primary care provider, and I'm an independent practice, which means I do not need a physician to supervise my practice. So I have patients from the age group of 17 up all the way to the geriatric age group, and I do primary care, disease detection, health promotion, prescribing medications, treating chronic diseases, and also general screenings which are age appropriate when they reach the age, which also includes the most important immunization.
So today our program is focused on saving a life with new techniques, screening for colon cancer. Can you talk a little bit about screening? What is necessary for people to do in order to get and detect early colon cancer?
So screening is a tool we use to look for a disease. Specifically for colorectal cancer, screening tools, we have stool tests and we have the colonoscopy, which is the gold standard guideline. The screening in primary care population starts at the age of 45 and it goes all the way up to the age of 75. Not that people older than 75 we don't screen, but it's the discussion which is done between the provider and the patient based on their risk factors, the chronic diseases they have, and the recommendations based on their general health condition.
So you're saying that between 45 and 75, people should get screened for colon cancer. Can you tell us a little bit more about that? You said this colonoscopy and then there's stool tests. What specifically is necessary to have that done?
So let me just make this clear that screening actually starts at 45, but not necessarily that it's not done earlier. It's based on a lot of risk factors which the patient may have, right? Now, the screening tools in the stool test, we have the stool guac test, which looks for blood in stools. We have the fecal immunochemical test, which also looks for blood in the stools. Both these tests are done on a yearly basis. Doesn't mean that they are a replacement for a colonoscopy. Colonoscopies, they are done every 10 years if everything is normal based on the outcome of the colonoscopy you had. You also have something called as the stool fit DNA test, which looks for DNAs, which can be DNA carriers for patients who are at a higher risk for colon cancer. That's done every 3 years.
Well, that's confusing. So starting at 45, if I have no risk factors, if I have risk factors, I might have it done before 45.
Yes.
What are those risk factors?
So the risk factors, like any other disease, increasing age is a risk factor. If you have a personal or a family history of cancer, if you are having any genetic hereditary conditions which can dispose you for colon polyps, conditions which make polyps in their body, that can be a reason. Certain lifestyle factors include obesity, inadequate physical exercise, people with actually one of the other things is chronic bowel diseases, the inflammatory ulcerative colitis, Crohn's disease, they put you at a higher risk. Also consuming alcohol, tobacco use, sedentary lifestyle, all this can put you at a higher risk. Increased use of processed meat in diet. Eating diets low in fiber, like less fruits, vegetables. Eating a diet high in fats are some of the lifestyle risk factors people have.
So that would put me at higher risk, so I would have to have these tests done before 45? Or all of that together, it puts me at high risk for colon cancer?
That's a good question, because this is why we need to see a primary care provider. So when you have that relationship with your primary care provider and you discuss your screening tests based on your risk factors, the provider directs you as to what is more recommended for you and what channel you take for the screening, at what age you start.
So assuming I don't have a family history of cancer, which is kind of hard to believe, because I don't know anybody who doesn't have somebody in their family who has cancer. Is it only colon cancer, or is it all other kinds of cancers?
So this is one of the myths people have in mind. If you see roughly around 1 out of the 3 people detected with colon cancer, only 1 had a family history, the remaining 2 did not. So this doesn't mean that only people who have family history are at a risk of colon cancer. Also, another thing is the lifestyle has changed for people all around us. They are used to more luxury, less physical activity. They prefer processed meat. They prefer eating foods high in fats, especially animal fats, which can also predispose to bowel changes. Alcohol is a common norm now, and even tobacco use can put you at a higher risk.
So assuming I don't have a family history of colon cancer, I am not overweight, I'm not obese, I don't eat a lot of red meat, I don't drink, and I don't smoke. You're saying even without that, starting at 45, you should still have a screening test for colon cancer?
Yes, definitely.
And that screening test, again, you said could be stool. That means that I go to a primary care doctor and they do a rectal exam, or is that something I can send to a lab? How does that work? I see commercials on television all the time. Can you explain a little bit about that?
So when you reach your age appropriation for the screening and when you see the primary care, they could offer the stool test to you, but they always will discuss the importance of colonoscopy. I tell my patients it's like doing an online shopping or an in-person shopping. When you do online shopping, you see the product looks good, you read the description, you bring it home. When it comes home, it's actually maybe not what you wanted. It's just a perfect, and when you do in-person shopping, you can actually see, feel the material, try it on. If it meets all your criteria, bingo, there you go.
Oh, I love that analogy. That's wonderful. So it's important to get a colonoscopy because that's not the online shopping. That's going to the store. That's a great analogy. But if I'm afraid to have that colonoscopy, can I have these stool tests done anyway?
Yes. Everyone who has hesitancy for colonoscopy, we do offer the stool test. But we also, every time they come in for their 3-4 months checkup or follow-ups, we have this conversation because stool test is not a replacement for the colonoscopy. Also, in the colon, there can be polyps. These polyps are asymptomatic. You do not need to have any bowel changes. You may not feel any symptoms in the early stages. Colonoscopy, you look in, if the polyps are there, they clean it at the same time, and then they'll give you a short-term follow-up based on what is the pathology of the colonoscopy polyp.
So what is a polyp?
As you know, cancer is something where cells grow out of proportion. Polyps are small growths inside the colon area, colon which means the large intestine, and the rectum which is the passage between the large intestine and the anal area. So these small polyps grow into the colon and they remain undetected, and they may change their structure and turn into a cancer. The earlier you detect them and take them out, the better for the individual who's being treated.
And how often do you have to have this colonoscopy?
So if colonoscopy is done every 10 years, but if you have a colonoscopy and a polyp is detected and removed, it is based on the pathology result, whether they have to come back in 3 years, 5 years, 10 years, based on the size of the polyps, the number of polyps, and what are the biopsy results of the polyps.
So why are people so hesitant to have a colonoscopy? I've had my colonoscopies, just so everybody knows, but I've heard there's so many stories about the prep. It makes you sick, and you're in bed for 2-3 days. Why is it such a big deal?
So the biggest concern with everybody is drinking that gallon of liquid. You know, it makes you poop your gut out, in simple words. The other hesitancy they have is they have to take a day off from work. They have to bring somebody along with them when they come, because you get mild sedation during the procedure. It's also, some people don't like drinking liquid. Drinking a whole gallon is difficult for them. I normally tell them, right, put yourself on a liquid diet so the cleaning is easier. Start drinking when they have been asking you, and try to flavor it if you don't like the bland taste of the liquid you're drinking. Currently in the market, you have new prep solutions which are lesser mLs. So instead of drinking a gallon, you are drinking 100 ml of the solution. You have super prep. You have some other ones which are out. The only problem comes is insurances don't cover it.
So is this something that you can talk to your primary care physician, your primary care provider, about different preps that you've had that worked and didn't work? And I have to tell you, in my life, there have been times when I had the prep and I went, gee, that wasn't bad. And then there were times that I looked and I went, whoa, I don't remember this 10 years ago. Is that something that you can discuss with your provider, or is it something you're just like stuck with?
No, this is something you can discuss with your provider, and the provider can give you the options which you have. They can also give you suggestions which will make your life a little more easier, because if you're having it for the first time, it's like writing an exam for the first time. You don't know what to expect, right? Unless you talk to somebody who's already taken the exam. Also, one thing I tell my patients is, especially ladies, they go crazy doing all these bowel cleansing things. This is a free bowel cleanse you get, you know, and then once you do it, and if everything is good, it's once in every 10 years.
So I want to go back to the stool test, because again, I see so many commercials on television that make it sound like this is really, really, I don't want to say better than a colonoscopy, but certainly just as good. Can we think of it as just as good for people who have no underlying pathology, no symptoms?
So the stool test has 90+ specificity and sensitivity. Without being said, you could also have false negative stool test, right? Because the only thing it's looking at is blood in the stools or the DNA, right? You could be, the basic aim here to enhance or to stress the importance of colorectal cancer is to early detect this disease. And this condition's early detection is based on the stool test, which can give you, but there's still a chance there can be false negative, right?
So if I do the stool test and it's positive, obviously there's something wrong, then I would have the colonoscopy?
So anyone who does the stool test and they come back positive, that means there's blood in the stools, right? It could be due to a number of reasons. But in order to, we always look at the most dangerous reason, right? It could be a cancer. But there could be other simple reasons like hemorrhoids or polyps. So we try to get these patients in earlier for a colonoscopy. The patients are explained, they discuss the results and stressed on why it's important. So they willingly go in for the procedure and they're told, if it is nothing, you're free for 10 years. If it's something, they at least can take care of it there and then, rather than you having it in you and making it worse in years to come.
So the positive stool test doesn't mean you have cancer.
No.
It just means you need to have the colonoscopy.
Yes.
And you're saying a negative stool test is not 100%, but 90% that you're doing okay. This is asymptomatic. You don't normally have symptoms, right? Except for blood in the stool. Is that something that is common?
So most of the colon cancers are asymptomatic in their early stages. Not that anybody will have a symptom. Yeah, sometimes symptoms in later stages, if they ever have, can be blood in stools. They can have a change in bowel pattern, constipation, diarrhea. Some have feeling that their bowel is not emptying correctly or it's not completely evacuated. You could have abdominal pains, aches, cramps. Some can also complain that they don't feel right. These are not that any of these symptoms are particular to colon cancer, but they may or may not. They can be other conditions. And that is why, again, the importance of having an open discussion with your primary care provider is important.
So this is really helpful. This show is about staying healthy, being healthier, and staying as healthy as we can. So it sounds like this is part of one of the things that you should take care of yourself and do. You mentioned immunizations, see your primary care doctor, have either a stool test and when it's appropriate, have a colonoscopy. Are there things you mentioned, sedentary lifestyle, eating a lot of red meat, obesity, I think you mentioned alcohol and tobacco use. Are there other things that put you at risk for colon cancer, other than those, I guess, 5 that you mentioned?
So, like I said, you could have bowel disorders, like people with Crohn's disease, ulcerative colitis. They already have the change in the bowel habits. They have constipation, diarrhea, constipation. That predisposes them at a higher risk. Then you can have certain hereditary conditions, which can be like Lynch syndrome, edematosis, polyposis, which you have excessive polyps in the body, which can put you at a higher risk for colon cancer.
And that runs in the family, right?
That runs in the family.
So my parents, brothers, sisters, grandparents, is that something that we'd know about?
We may or may not know, because based on where our parents, grandparents, and how good we were with going to a medical provider, getting our screenings done, or knowing about our own health conditions. If I ask my mom what her parents had, she doesn't know. So I guess I come from India, where treatment was the gold standard compared to prevention. Not anymore, but back in the days, it was treating a disease before it was formed.
I think that's really important. What we talk about is exercise, staying away from tobacco and alcohol, and be healthy. But you're also making a very, very important point that being healthy also means seeing your primary care doctor and getting these tests done, and finding out that there's a problem as early as possible. So let's talk a little bit about colon cancer. I hear rates are just going up and up and up. Is that true?
So initially the colon cancer screening age group was 50. Back from 1970 to 2020, the rates in deaths and mortality and the colon cancers have decreased by 57%. But there was higher increase in detection of disease among people who were less than 50 years of age. That's why the screening age group was dropped to 45. So we can have early detection in people in the age group.
Wait, so the numbers are going up because more people are getting diagnosed earlier. Is that what you're saying?
So the number of people above the age group of 50, who have been, the screening rates have increased. So that definitely brings in more people. But the treatment has increased for them too because they're screened early. But younger people are now being diagnosed. So the age bar, which was 50, is now brought down to 45.
So the earlier you have the test, the earlier it's detected, the
Yes.
earlier you get treated. And again, back to making sure people are as healthy as possible, in this case, getting treated. Can you talk a little bit about treatment? Is that always surgery? Is it chemo? Is it radiation? Is it all of the above? How bad is it?
So like you mentioned, the 5-year survival rate, if it's detected and treated early, is 90%. So if they're detected early, it's removal of the polyp. You look up the biopsy result. You also have to look to see if it's contained or it's spread, right? All this discussion is based with looking at all the angles of where the cancer was found, what was the size, what other areas were involved. Depends upon what type of treatment you get. Maybe after the removal, if the pathology came back benign, for a polyp, or you don't need to do anything, but you have short-term follow-ups you do. It could be 1 year, 6 months, based on how many polyps were removed.
So when you say the polyp was removed but it was benign, meaning the polyp was taken out, it's not cancerous, so you don't have cancer, but was there the potential that would have turned into cancer?
Yes.
So we're really talking about early prevention. That's really important.
Yes. So when the polyp is seen, that means that area, the cells grew out of proportion. It shouldn't have been there. You're taking it out, which means that if you would have left it inside, there was a chance that given a few years, it would have grown and changed and spread to other areas, right? It could have changed, the cell morphology would have changed, the structure would have changed, and it could have become into a cancer. And you're trying to prevent that from happening by early screening.
I love that. I'm going back to your comment about online shopping versus shopping in the store. So you had a polyp removed before it ever became cancer. You can't get better treatment earlier than that. That's fantastic. Where would people go if they want more information about things that are available to them about colon cancer and colon cancer screening?
So everyone likes to go on Professor Google. I call it Professor Google because I have people who come with sheets of paper from Professor Google. I tell people, go to reliable websites because Professor Google doesn't know you as a patient, right? One website is the cdc.gov. You have enough information on how to get screened, what questions you have, what are some of the myths you may think it is, colon cancer is. You can also go to cancer.net. You can go to colorectalcancer.org. You can also, the best person you should go is to your primary care provider because that person knows you better than any of these websites.
And when you talk about your primary care provider, for so many years we were talking about a doctor. You're a nurse practitioner. So talk a little bit about being a nurse practitioner. What brought you to this field, specifically wanting to help people be healthier and get screened for colon cancer earlier?
So when I was studying, I wanted to become a doctor. But back home, financially, I was not well off. So given the entrance, my parents couldn't afford to send me far away with the tuitions and the boarding and the lodging, and I decided to become a nurse. I enjoyed what I did. I came here, I saw as a nurse, you had so much independence to do things, But then there was one thing that held you back. One thing which stopped you from making decisions because you always needed a doctor to give the order to complete. So no matter how patient-oriented I was, I couldn't get to things because of this one thing. And I told myself, I think I could do the same job, And I think if I get trained, I might be able to perform some justice to what the role is. And with the support I got from my family, I decided to go back to school. And I love what I do. I love primary care. And I do think they are like another family to me. I see them a few times a year. I know them in and out. I know what happens in their family, what's the occasion, who died, you know. I have families with their brothers, sisters, parents, spouses coming to me, their extended friends coming to me, and I feel great.
That's wonderful. And most importantly, you're saving lives. And I just want to thank you. Another way of helping us all stay healthy. Well, that brings us to the end of our program today. We thank you for tuning in and learning alongside of us. For more information about our show, please call 718-510-2103 or visit www.zurmed.com. Stay updated and engaged with South Brooklyn Health by visiting us online at www.nychealthandhospitals.org/South Brooklyn-Health. This broadcast was brought to you by Brick Media in partnership with South Brooklyn Health. Stay healthy and stay well.